Today we have Sharon Miller with Personal Balance Acupuncture. We're going to actually talk a little bit different than talk about a subject a little bit different than the things we normally cover, which is mostly financial and business advice. But we're actually going to find out a little bit more about how acupuncture can help with your general life. And we are starting to get a little bit of background there, Sharon. You might want to turn that speaker down just a little bit more. There we go. So, Sharon, how about going ahead and introducing yourself and letting the folks know a little bit about you and a little bit about your business.
Okay, good afternoon. I'm Sharon Miller with Personal Balance Acupuncture, and I help people with different health issues. Majority of the patients that come to see me have pain issues of some sort: low back, neck, shoulders, hips, knees, plantar fasciitis, um, just a myriad of different pain related issues. But additionally, I can work on sleep disorders, digestive disorders, anxiety, depression, PTSD, um, as well as autoimmune uh, conditions like rheumatoid arthritis or psoriatic arthritis, um, even Crohn's, colitis, things of that nature, IBS. It's just unreal the plethora of conditions that acupuncture can be helpful with. Um, it's also beneficial for people undergoing chemotherapy to help with the nausea and the other symptoms that are related with chemo. Um, I mean, I could go on and on with the different things that it could help with. It's just unreal.
Great,
I also do pediatric acupuncture as well, where I can help infants and children with different conditions as well.
great. One of the things that I found most interesting about your business is that we all, there's a we everybody jumps right to the conclusion about the needles, but I found the intake process and the interview process to be a lot more in depth and looking at you had a very thorough intake process, and I wonder if you could talk to that a little bit, about why it's so important to do such a deep patient history at the intake process.
Sure. Um, One of the keys to my particular version of acupuncture, so I do five element. There's many, many types of acupuncture. Five element is one of the many. I mean, it would take a lifetime for me to learn all of them. It's that vast. But five element is nature based, and it looks at the person as a whole, as part of nature. So when I go through my intake, I want to see how these people relate to other people. So I want to look at their social history and uh, see how that correlates with the way they present to me in the office. I also look at their medical histories to see if they've had surgeries, to see what kind of traumas they've incurred, um, and then of course family history. Believe it or not, a lot of initial traumas are incurred through family. um, there's more issues with sexual abuse and molestation within the family unit than people realize. And so knowing that somebody has gone through an experience like that reveals a lot about the person. That's an emotional trauma right there, in addition to being a physical trauma. And those types of things stay in the body. While we can go to counseling and or therapy to learn how to cope with those things emotionally, Getting those traumas out of the body is a different issue. And acupuncture can help to move those things out of the body. So it's very important for me to know all of those aspects about a person, the medical, the social, and the family histories on these people. And I try to go into depth as much as I can with specific instances. The more I know, the more I can understand that person and be better able to focus on what their needs are from an acupuncture standpoint.
Great. And I was looking at the types of people that you can help, and it really is a wide range. And one of the things I found most interesting is that for most of these conditions, people are seeing a normal doctor or a mainstream doctor, and they may be having complications from the normal treatments, or they may just not be getting complete relief. And I found it very interesting that what you do tends to complement what people are doing in other parts of their other parts of their health and wellness regimen. Can you speak a little bit to how well you fit in with some of the traditional things people might be doing?
Yeah. So acupuncture doesn't have side effects. The most common, I guess I shouldn't say it doesn't have any. The most common side effects are bleeding at the needle site, maybe some itching at the needle site, and occasionally you might get some dizziness after the acupuncture treatment. Other than that, it really doesn't interfere with any medications that you're taking, other than perhaps if you're on a blood thinner that may lead to easier bleeding from the needles. Um, but I really haven't experienced too much of that even with people that are on blood thinners. It doesn't seem to be as uh, large of an issue as one would think. The needles that I use are so tiny, they're literally the size of three head hairs. So they're very, very tiny. And so the insertion site is going to be rather small, which alleviates the uh, possibility of severe bleeding. But yeah, the acupuncture complements pretty much any therapy. I have people that are going through addiction um, uh, therapies, and acupuncture can certainly complement that. It helps with the physical as well as the emotional aspects of addiction. Um, and same with any other condition. Even though you may be taking medications for that, you may not be getting the full relief, like you said, Marty. And so acupuncture can pick up that slack, so to speak, and be the intermediary that kind of brings the two together. It relieves those additional symptoms that haven't been alleviated through the pharmaceuticals that you might be taking, and bridges that gap. And it can do that with a number of different conditions.
Great. Um, one of the um, one of the fears most people have is of the needle that you brought up. Um, I guess the question is how if somebody's got a really big fear of needles, should they really fear acupuncture, and are there ways that most of the time we think of fear of needles as when you go to donate blood or when you need to have a panel run, and acupuncture is absolutely nothing like that. Can you speak a little bit to the differences and why somebody who might have a traditional fear of needles shouldn't fear acupuncture?
Well, the needles that they are using to either take blood or perhaps give you a vaccination of some sort, or flu shot, anything like that, their needles are hollow because they have to have liquids going to and from in the needle. So they're much larger in diameter than my needles. My needles are solid, they're not hollow. They're very, very thin and tiny. So the pain that you experience when you get blood drawn or when you get an injection um, is due to the fact that the needle is large and it's puncturing the skin, and it's taking up a rather large diameter when it does that. My needles are not that large, so the sensation that you get when the needle goes in from acupuncture is very minute in comparison to that of a regular needle at a doctor's office. Um, the additionally, in many cases, people don't even feel the needle going in. They will, however, sometimes experience what I call a zing sensation, which is kind of a mix between when you have like a electrostatic electricity and you touch something and get that zap. It's kind of a mix between that and a tingling sensation that kind of comes out from the needle. That's the best way I can describe it. It's a unique sensation that is better understood once you've experienced it. And it's not really painful. Um, it's just unique. It's a different sensation than what you're accustomed to. Um, but as far as the needles, most points are not, they're not painful. Of course, there's going to be a few here and there, like ones at the nail beds of the fingers or near the nail beds of the toes, are probably going to be a lot more sensitive than others in the more fleshy areas like the bicep or the arms or the thigh area of the legs where you have more flesh. Um, but overall, I would say that there is no real pain involved with acupuncture needles.
Great. Yeah. So it's also the lead up to the needles is a much different experience than an experience walking into, say, a laboratory where they're going to do a blood draw. So can you talk a little bit about what you do to get the patient ready before you actually do the needle treatment or the normal acupuncture treatment?
When patients come in for a needling or for an acupuncture treatment, the the first thing that I do is I sit down and talk to them. We go over um, any previous treatment and any experiences, anything that they've experienced that they was different than prior to the treatment. We go over that and see what shifted, what has moved, what has changed. I take pulses. Um, Pulse taking in acupuncture is significantly different than what you get done at the doctor's office. There are three pulse positions on each arm, and each one of those pulse positions corresponds to two organs in the body. For example, on the left wrist, you have the three spaces, and at the top position, that pulse correlates to the heart and small intestine. The middle position correlates to the liver and gallbladder, and the bottom pulse correlates to the bladder and kidney. So I can assess the energy of each of those organs by palpating the pulse in your left arm for those particular organs. And what I'm looking for when I'm palpating that pulse is I'm looking for the quantity, how hard that pulse comes at my fingers. Is it wide? Is it short? Is it fat? Is it thin and wiry? Um, does it feel like a ball bearing under there? Does I'm looking for qualities and quantity in the pulses, and that tells me a lot about where that organ is right now from a functional standpoint within the body. And so I can assess whether or not you have a block in your energy system. So just like your blood vessels and arteries and veins and all that take body out to the extremities, and then you have others that bring it back to the heart. You have energy systems or channels, meridians, we call them, that kind of do the same thing. And it's all interlinked, just like the blood system is, where it comes back on itself. So I can actually tell from the pulses if there's a block in the energy system somewhere. And acupuncture can open up that block and relieve it. So kind of like when you get a blood clot and you have to get blood thinners or whatever to remove that block and get the blood clot to move and break up. Acupuncture does the same thing with an energy block in the channel. And I'm not sure if that answered your question, Marty, or not.
Well, no, yeah, I think that that's the there's a lot of misconceptions and misunderstandings of what a appointment with someone like yourself is going to entail. And I think it's the biggest surprise to me was the amount of prep work that went into it. There was the initial interview, and there was the interview with each visit to kind of talk about how things are going and changes from last time. And then you do the diagnostic steps you take before you decide what goes into each treatment each time seems to be a really big part of it that was also unexpected. You kind of went through a lot of that, but also there was a complete different feeling of lying down and getting ready to have acupuncture versus actually walking into a doctor's office and getting ready, getting a blood draw or something like that is, I think that's a general misconception that a lot of folks have, that it's going to be that there's anything even close to the same thing. So the fear of needles is the primary objection people tell me whenever you talk about acupuncture. It's like, and there's really no like you said, the needles are nowhere near the same, and it doesn't feel the same. There's just nothing close between the two that people should have a fear from, or if they've got that fear of needles, they really shouldn't because they're not even close to the same.
Right. Well, when I work on children, we don't even call them needles because they already have an association with a needle from a doctor's office getting a shot. So when I work on children, we call them taps, and that way they don't have that association. And I usually try to get the children, depending on their age, involved in the treatment with me. For example, if I was going to needle large intestine 4 here in the uh, meeting of the two bones of the thumb and the index finger, right in this fleshy area, I probably would have the child massage it first. I would massage it, then the child would massage it, then I'll tap it, and then they'll tap it, and then I'll tap in the needle. And that way they participated with it and prepped the area ready for the needle. And when I tap it in, they don't associate that with the needle because the sensation, like I said, is completely different. So perhaps if we did that with the adults, they might have a different association as well. Maybe they shouldn't be called acupuncture needles. Maybe they should be called taps. Um, 'Cause I think it's a lot more subtle of a term than what people associate with a needle.
Well, the other thing is that how long does a typical visit take? Is this something that you is it
The
a lunch
initial,
hour or
yeah, you could do it on a lunch hour if it's just the acupuncture treatment. It's usually about an hour, typically. You come in, we sit for about the first 10 minutes going over things and doing pulses, possibly looking at the tongue, which is also another diagnostic tool. Um, and then you get on the table. Once we decide what the treatment's going to be, you get on the table, and I insert the needles, and then you lay there for approximately 20 to 30 minutes with the needles in, so that they can do what they need to do. And then I come back in the room. And while you're in the room, I usually have on some kind of sound going, whether be it the ocean or rain or whatever your liking is, some kind of sound that you are comfortable with, that helps to relax you while you're in the room. Most people that get acupuncture fall asleep during that time. That's how relaxing it is. And like I said, then I come back in the room, I remove the needles, I take pulses again to see what the difference is prior to treatment and after in the pulse situation. And that tells me if we've moved what we needed to move. Um, and then we reschedule for the next visit. So it's very simple and easy.
and it really doesn't affect the rest of your day. You can go right back to work, and it's unlike other treatments, like more traditional doctor's treatments. It doesn't prevent you from just going back and joining up with the rest of your day.
That's true. And actually, most people are more relaxed, more calm. and in a better mood when they leave from an acupuncture appointment. It is similar to chiropractic or massage, where you should drink plenty of water after an acupuncture visit, because just like those other modalities, it does move toxins out of the muscles and out of the body, and you do need to flush those through with drinking plenty of water.
And over the last couple of years, obviously, the pandemic has caused a lot of additional stress with folks. Have you been able to help out with some of the newer problems that people are experiencing because of well, it's less the pandemic than the reaction to the pandemic, the shutdowns, the lockdowns, and the other
Yeah,
stressors?
one of the things I've noticed is that there have been a lot more people with anxiety. I've had several students, even with them not having the social interaction that they typically have, they've experienced a lot more anxiety, believe it or not, from not having that socialization. And I have great treatments. I've had several teenagers in here that I've done auricular treatment on, which is just needles in the ear, um, 5 needles in each ear. And then what I do is I leave them with what we call a press needle. It looks like a tiny band aid, and in the center of it has a little tiny needle. And you can put it on one particular point in the ear. And if they start to feel the anxiety in between the visits, they can just gently squeeze on this little band aid, and it helps to calm them down and bring that sensation back from the acupuncture. Um, but I've also helped people with post COVID symptoms. So, after experiencing COVID, a lot of people are still having trouble with things like headaches, balance, loss of smell, and all of those types of things can be addressed through acupuncture and are extremely effective. I had a gentleman back in November when I was at the Festival of Light who had had COVID, I think back in March of 2021. This was November of 21. He was still having severe migraines up in this area, and was having to walk with a cane due to the dizziness and vertigo that he was experiencing. He had to sell his car because he could no longer drive. um, I did some work on him up at the Festival of Light and was able to alleviate the headaches, the migraines, and he also was able to walk easier and was walking the rest of the day without the use of his cane. So it's amazing what it can do to really respond to some of these after effects from COVID.
Yeah, it kind of goes with the my theme for the year is that you don't have to put up with things. If you've got a problem, talk to somebody for the crying out loud. Find something that works for you and do something about it. Don't just accept things as they are. A lot of folks, the primary concern I'm seeing now is a new um, uh, anxiety over returning to the office and getting back out among people with people who've been cooped up for 2 years. Um,
Mhm.
I'm seeing a lot of people who are very nervous about returning to an office with other people, um, and having to get up and dress every day. Are you seeing some of that, and do you have and can you help people who are experiencing those symptoms?
Absolutely. Yes, I can definitely help people that are experiencing that. I haven't seen that as often as I have with the students experiencing the anxiety, but nevertheless, I do see some of that. And there's there's more than one way to address anxiety. It doesn't have to be the needles in the ear. Um, when I do the initial intake with people, I'm also trying to assess where they fit in the elemental picture, the 5 element picture. Um, we all have all 5 elements in us or within us, and but we typically tend to live in one of those more than the other. So, for example, if water CF, the element of water, they live there more than anywhere else. I may use points on the bladder meridian or the kidney meridian to address their anxiety. Whereas somebody who's an earth, um, I may go ahead and use the auricular, the 5 needles in the ears. But there's definitely different ways to address it depending on the person and what type of anxiety they're experiencing and how it manifests within them. Because everybody seems to experience it just a little bit differently. Some people, I've had some people that have a tick or a twitch that they get in an eye or around in the face somewhere when their anxiety comes on strong. Other people have breathing issues and start almost hyperventilating. Other people might get tremors or something else. So it just depends on you know what aspects they're dealing with as far as the anxiety, what how it manifests within them as to how we would address it.
Yeah, I know we spent a little bit of time, a little bit more time on anxiety than probably plan on, but I just that has just been such a big part of the last couple years, and it almost feels like everything in the news has been aimed at trying to steer people to be as anxious as possible. Um,
Mhm.
and I think that the side effects of that are going to last a really long time. And I think it you know, and it's good that there's somebody like you out there that people can go to, because a lot of times the more standard treatments for anxiety just seem to make things worse. I don't know why. It's one of those problems that you have that a lot of times the thing that's recommended to you um, seems to make your whatever's causing your feelings of anxiety to sharpen instead of dissipate. And I think that the acupuncture, because it really does take your mind off of things and kind of you just kind of lie there and focus on the treatment. I think it gives your brain a break, and as it's a treatment that doesn't seem to make things worse than before they get better. Um,
Well, acupuncture is about manipulating the chi or the energy. So if you shift that energy, focusing on fear, it can alleviate that anxiety. But fear has been, the biggest propaganda, I think, in all of this that's been going on for the last 2 years. And I've seen a lot of people suffering with what we call kidney yin deficiency. So the water element is correlated to fear and anxiety. That's the emotional aspect that correlates to the element of water. And when you have, and so that also correlates to the organs of the bladder and the kidney. So when people have a lot of low back pain, and along with that, they're experiencing dizziness, dry mouth, ringing in the ears. That's a group of symptoms that is known as a pattern that we can address specifically. So kidney yin deficiency has those types of symptoms that I just stated: low back pain, weakness of the knees, dizziness, ringing of the ears, dry mouth, heat in the afternoon, like you feel very hot around 2 or 3 in the afternoon. You might even get what they call a malar flush, which is like where you get a redness around in here. Um, and I've seen a lot of that in the last 2 years. People that are coming in with low back pain are pretty much having the kidney yin deficiency. So I can treat that low back pain through treating that pattern, that deficiency, and um, and really make a huge difference with all of the symptoms, not just the low back. So again, I think that a lot of this is coming from the fear that has been propagated in the last 2 years, and people don't even realize that it's there in their even in the back of their mind. You know what I mean? They don't put two and two together. This fear is what they're running on, and it's causing a lot of these symptoms. So the fact that acupuncture can come in and alleviate it, even though you don't think it's forefront in your mind, is pretty amazing.
Another complaint that's been very common among folks is they seem to be experiencing kind of a lethargy over the last couple of years, where they just don't feel like doing things, They don't want to get up and go to work, or they don't want to get up and get out of bed. It's even an effort to get up from the TV to go to bed at night. Are you seeing some people coming in with symptoms like that? And can you help out with that?
Absolutely. There's a lot of things I can do to increase energy. Um, Moxa is one of them, which is kind of an uh, unusual thing that you probably would never see in any other type of modality. It's an herb called mugwort. I know that sounds kind of Harry Potter, but it literally is an herb that we roll up into like an incense cone type of thing, and I can put a bed of salt on your belly button and burn this moxa on this bed of salt. And it's got an oil that residual oil that comes off of it that seeps down into the skin and into the belly button. And the reason why we do it in the belly button is because that's your center of energy. And if you think about it this way, when you heat up molecules, they move faster. When you things move faster, you get more energy. So if you think about it that way, when we burn that moxa on the belly button, we're actually heating up that area and increasing the speed of the molecules and increasing therefore your energy. Um, it would have to be done several times before you notice extreme difference, but you will notice subtle differences just from a treatment like that. Also, there's things that I can do for insomnia. There's several different treatments or different ways to address insomnia. So, for people that are struggling to get to sleep, there are things that we can do to help you out with that. Um, but the lethargy that they're experiencing, I think, is a lot of times is from the weight of everything that they're facing right now, in the world in general. I mean, things are pretty crazy, and we're getting fed all this information, and we don't know what to do with it. Whether it's, how to interpret it, how to maneuver through it, and it's it makes us drag on. We don't know which way to go. And so when we're indecisive, sometimes we tend to just procrastinate or put things off or just ignore them. And eventually, over time, you get worn down. And so the lethargy comes into play. And so acupuncture can definitely be a wonderful resource to help with situations like that.
Well, I definitely think that the world has gotten weirder. That's for absolute certain. I mean,
Yeah.
well, I mean, even like the last 12 years have just seemed like, well, even maybe even the last 20 years, since 2001, where it just seemed like one thing after another, and it just got faster and weirder, and just there's just so much going on, and life just does not seem like you can't make a plan and expect that there's always some news story or some major event that's causing us to to have some conflict in life, and we just can't we can't tone things down. We can't return to kind of a nice I think like like in the 80s, we're talking about it was more of they talked about centering on the self and being concentrating on me or the me decade or whatever. And you can make fun of that and say it was bad, but at least people were a little more empowered to see the scope of what they could control and live within that. And it seems that since 2000 or so, the focus has been on the things outside of you that you can't control, and that just leads to a lot of stress and it seems like other health issues seem to creep into it, and our normal approach to those things are less and less effective over time. So I know a lot of there seems to be a big increase in digestive issues, and a lot of times changing your diet and using the right supplementation can help that, but a lot of times that's just not enough. So how is that something else that you think that you can offer a solution to, or at least some help?
Yeah. I have a lot of people that suffer with acid reflux or indigestion, um, heartburn types of things. We call that rebellious stomach chi. And there are points on the CV line in the center here that you can do that will actually tell the stomach chi to go in the right direction, not rebel, and come back up. And those treatments are very effective. I've gotten people, several people, off of meds for acid reflux due to this treatment alone. So, yeah, it can definitely be helpful.
Right. One of the more common uh, things that people talk about and complain is as our population is aging is chronic pain. You already talked a little bit about rheumatoid arthritis and some of the other arthritis and some of the, but there's a lot of other reasons that our aging population is in has a lot more pain than has been experienced in previous decades. Can you talk a little bit about how you can help people manage chronic pain from some of their other diseases, and what a treatment regimen for that looks like?
Um, let's see. I mean, fibromyalgia is probably a big one that's come around in the more recent years. And acupuncture is a wonderful treatment for fibromyalgia. Um, Partly because when you're working with the energy, a lot of people think that we're working on nerves or things like that when we're dealing with pain. And acupuncture doesn't actually necessarily work on the nervous system itself. It has a what's the word I'm looking for? A response that is not pathological, but the word escapes me right now. Anyway, when you put a needle into the body, it causes a reaction, um, and many times it induces an immune response. And so, if you've got an autoimmune issue, which many of these chronic pain situations are some type of autoimmune, um, you're creating this immune response with the needle. And so it can turn around some of these autoimmune things. For example, my mother had rheumatoid arthritis. Her fingers were twisting, her knuckles were getting larger. And we worked on her. I worked on her like at least once a week for probably 3 or 4 months. And just having that treatment regularly like that over time, I was able to put her into remission. Now, I'm not going to say that that's going to be the case with every autoimmune immune condition, but it definitely warrants investigation because it can be amazingly in, incredible responses to the acupuncture with any type of autoimmune immune condition. Pain is generally the biggest thing that acupuncture seems to be most sought out for, and it's definitely effective in treating that. Um, for example, let's say if you had chronic low back pain, typically what I would do is work on points that are on either side of the spine at the low back. And then that particular meridian is called the bladder meridian that goes straight down the back on either side of the spine. Then it goes down through the buttocks into the thighs, straight down the back of the leg and out the feet on the pinky toe side of the feet. So if I was to put needles in the low back area where the pain is actually being experienced, then put needles in the lower extremities, maybe at the back of the knee, some at the calf area of the leg, and then out the feet. What I'm doing is drawing that energy that's kind of stuck there in the low back and maybe contributing to this pain. And I'm literally pulling it down and out the body through the feet. Um, and just doing that can alleviate the low back pain in many cases. So that's a sample of what a treatment might look like for low back pain. A lot of people are also holding their stress in their neck and shoulders with everything that's going on, and they're experiencing pain that stems from the back of the neck down into the shoulder blade, and then sometimes even down the back of the arm and into the wrist. Again, there's There's that's the small intestine meridian that goes down that arm and down through the pinky of the hand. So I may do needles that are up in this area, and then again take it out through the hand and pull it out that way, that energy, and alleviate that pain that way.
So how long would it take before before a patient starts to see their pain alleviated, any pain alleviation after a treatment? Is it, how long does it take?
It It depends. Depends. Somebody who's been experiencing pain for 10 years, it's probably going to take a little bit longer before we can get things to move, because it's like a muscle that you've been using the wrong way for 5 years, and now all of a sudden you want to use it the right way. That physical therapy, again, is going to take a while to retrain that muscle to be used the proper way. Same with acupuncture. If you've had that pain for 10 years, it's going to take a while for the acupuncture to retrain that energy to move differently and to respond to those needles. It may hold for a little bit and then dissipate off. So you might get some relief for 1 or 2 days and then it comes right back. But acupuncture is cumulative. So each treatment that you get builds on the last. So you may need to come in twice a week instead of once a week to really get it to move and respond the way you want initially. Um, some people I get in, and after the intake, what I typically do is what I call block treatments, which I think we spoke about briefly, is to like remove any emotional traumas or physical traumas in the body. And then we also work to remove what we call aggressive energy. Sometimes just doing those block treatments, I find people have their symptoms reduced or their pain reduced just by clearing those blocks out of the way. Um, and I think the reason for that is because those blocks are attached to the pain and the sensation that they're getting. Um, Somebody who was in a car accident 10 years ago and got severe whiplash, they may still have the emotional trauma of that as well as the physical stuck in their body. And just doing those block treatments to remove that out of the way opens up the energy or the area in the neck that was holding on to all of that and may alleviate the pain.
So do most people that come in have more than one issue that needs to be resolved?
Um, Not typically. Most people come in with a specific issue most of the time. Um, but I have other patients that come in with a myriad of conditions that they want to work on. Um, Typically, I don't like to work on too many at once. We try to work on one or two things at a time. And then once we've got those moved um, to, uh, to be less, um, I guess, annoying or less pain or less whatever the situation is, um, then we can start looking at the other situations and see what we can do to work on those.
So is it the kind of thing where you have a certain order that you have to address because of the maladies, or do you kind of focus on the experience of the patient and deal with whatever their highest
More
priority
the
pain is?
experience of the patient. Yeah, I want to know what the patient feels is most important to them to work on first. What's the most aggravating symptom, or what's the most, um, important to you to move out, to get out of the way, or to alleviate at that time. Um, you know, their back pain might be secondary to their neck and shoulder pain, or their knees may be the priority before they want to do anything with the back. So it just depends on the patient and what their priorities are.
Great. Is there any specific symptom that somebody might be experiencing that you would say definitely come in and see me right away? Or is there something that when you hear you're sitting here and somebody's complaining about something and you say, well, definitely come on into the office.
Um, I would say probably low back pain is the biggest one that I hear the most often, and that it's typically the one that I can do. It's easy to typically move that. Rare instances, it can be difficult and it might take a little longer than I anticipate, but most of the time I'm able to move low back pain without an issue. Sleep disorders are probably secondary to that because if you're not getting good sleep, your body's not functioning properly anyway. Sleep is very important, and it's also important when you go to sleep, and that you're asleep during certain times of the day. In that 24-hour cycle, organs regenerate at certain times. So if you're not asleep for the liver to regenerate, you're causing more harm than you are good. The liver regenerates between 1 and 3 a.m., which is why this is the time you should be asleep so that your body can do what it naturally needs to do to regenerate that organ. So, sleep is probably the second one that I would say if you're having trouble with. Definitely seek out some help from acupuncture. It can be very beneficial.
Uh, can you offer some relief from folks who are doing shift work? I know with the pandemic, we've had a lot of people take jobs in warehouses and shipping and trucking and all that kind of stuff, where they are really not getting regular sleep.
Yeah, that's a tough one. The best advice I could give, yes, I can definitely do things to help because I can support those organs that are not getting that regeneration and the attention that they need at the proper time. So I can help support those organs um, while they are doing the shift work. But there's also things that they can do, excuse me, to help themselves. Making sure that they're tending to themselves properly and giving themselves other times of rest, like when they are sleeping in the day or times like that. Make sure that they're getting enough of it. Make sure that they're taking the time to get that 8 hours or whatever they need. Um, a lot of times I know they're on 12-hour shifts, which makes it difficult as well. Um, but there's other tools that we can offer for them to utilize that will help with situations like that, in addition to the acupuncture.
Cool. Yeah, I think that my personal experience has always been that other conditions like pain or anything else seems to cascade into a problem sleeping, and once that happens, it's a downhill spiral from there. It's just um, so
It can be because sleep is vital. Sleep is when your body is repairing things and like I said, regenerating certain organs and things like that. So if you're not getting that sleep, your body's struggling to do all of those things that it should be doing.
I always find is that there's always that one thing that's causing the sleep disruption. So being able to sleep better while you're addressing it. I know when full disclosure, Sharon is my acupuncturist, so the one thing that she was very helpful with was in dealing with. I have both arthritis and some some healing from some surgeries from having some malformed feet addressed, and the probably the best thing was being able to sleep even even while I was coping with the healing from that injury. So that to me that was the probably the biggest benefit was you know was being able to get that full night's sleep and not have those compounding pain symptoms from not just the initial problem but the compounding issues of not getting enough sleep that cause other pain issues that were cropping up. Um, so we're rapidly running out of time, and before we go, I wanted to find out if there was anything that you wanted to say to to promote the business or to let people know about acupuncture.
Um, I think the most beneficial thing I could probably say to people is that don't discount acupuncture just because you have a fear of needles. It's not what you think. I think it's definitely worth a look worth time to take a look at, and see if it's something that might work for you. Um, Also, I think that with all the paradigms changing out there all the time with in healthcare, I think that parents should even be considering this for their children. Excuse me. It's amazing what a holistic approach can do for simple situation. Excuse me. I'm so sorry. For simple situations for infants and children like colic, eczema, even slow moving bowels. Uh, sorry, and things of that nature.
Sorry, we did. That's one of the problems of an interview is that if you're not used to talking for an hour, it can be a little rough on.
Right.
Oh, sorry, my beagle has decided to interrupt the on what she's doing here. Um, but yes, that was one of the things that I was always really resistant to acupuncture. I kind of had the belief, we can't help, or it's just odd, or then my wife kind of talked me into giving it a try, and I have to say that I'm very happy that I did. It was one of those things that I did not expect to help as much as it did. So, having an open mind is important.
It is definitely.
What's the old line? Is you're never as young as your mind is open, or you're only as young as your mind is open. Sorry, my this beagle has decided that she wants to be on in this interview for some reason. Normally she sleeps because she's old, but today she's decided that she has to get on. I don't know if you can hear her. Just she's making a lot of noise. Anyway, we have completely run out of time. I apologize for a little time management issue there. Um, Again, folks, Sharon's contact information is in the description. Please don't hesitate. Give her a call and talk to her about your condition. I'm sure she can help. Again, I want to thank our sponsors this week, Digital On Ramp WSI, for all your digital marketing needs. Um, so we're still doing. It's talking about difficulty in sleeping. We've got Pillow Sonic. It's a great under the pillow speaker that helps with tinnitus and falling asleep. You can listen to relaxing music, podcasts, books on tape, anything that helps you relax. And finally, fun gifts for everyone, which is novelty gifts. There's gonna be a lot of stuff added to the store for what is it, Valentine's Day coming up. So look for stuff there. And next week we are going to be having a discussion on nuisance insurances. What insurance should you buy? Should you buy the helicopter life flight insurance? Should you buy the utility insurance that you're constantly getting sent by your cable company? Other stuff like that. So we'll be looking into that next week. Sharon, thanks again for your time. It was a great amount of information for the audience.
Thank you for having me. It's been a pleasure.